welcome back to Dr. Noah's YouTube update, and I review the scientific literature. So this was from a UCLA study that's showing that increased muscle mass decreases type 2 diabetes. Now we've talked a lot about type 2 diabetes. Cindy and Don have a great website that we'll plug a little later on in terms of cures for the incurables. Well, type 2 diabetes is 100% curable, and that's one of the tragedies, one of the most prolific type of diseases that are out there that can be treated very, very well. It's not easy because you have to make lifestyle changes, but easy in terms of cost versus in terms of availability. You can do it right now. You don't need a doctor, maybe a little guidance here. As we've talked about, the classic study in the Archives of Internal Medicine, natural, once again, was 3,000% less expensive than the drug way. So, I mean, that's why it's not motivated. So in this study is showing that by exercising, and especially weight reduction, we know that muscles are very, very, what's called metabolically active. That means is that they burn up energy, and when they burn up energy, they burn up sugar, and that's part of the problem with diabetes. You have too much sugar because your body has what's called insulin resistance. Your insulin isn't working right because your lifestyle, think of it like coating this insulin so it doesn't work well. And they were able to show for every 10% muscle that you gain, you're able to decrease the diabetes by at least 11 to 12%. So just one little approach like that has a major impact. Drugs don't have it. And that was published in Journal of Clinical Endocrinology and Metabolism, July 2011. I'm sure you read that every week like I do. FDA is on fast track. That's just not working. Drug companies and medical supply places, once again, have the FDA and these agencies in their pocket, because one year the FDA is working for so-called us, and next year they're working for the drug company, and it goes back and forth. So their motivation is obviously for their own self-interest, not for the safety. And so in this particular Institute of Medicine article, July 2011, saying is that this particular type of system, this fast track, what's called a 510K fast track, is dangerous because it just puts more junk out there with no type of real science. The real science is it's a big experiment, in terms of all these people are now guinea pigs, and then we find out a year or two later that hundreds of thousands of people have been killed or murdered, and then we go, oh, poor us, and then we kind of withdraw that. So more stringent things. This is just another indication how sick our society is. More pregnant women having strokes. Now, most women that have strokes are, young. I mean, that's just part of it. Of course, over the last 30 years, that has moved up in terms of age. But I mean, in this article here in Stroke, the most prestigious drug journal on strokes, July 2011. That's right, cutting edge. That's this month. Showed from between 1994 to 2007, there's been a 47% increase in the number of women having strokes. I mean, it's just madness. And they kind of like, this kind of mystery of what it is. Well, people are sick. I mean, when you're sick, anything that you do, even when the natural thing of having a baby becomes, once again, more of a stress on your body and causing more type of problems. I mean, it's a sign that our civilization, especially the industrialized one, is getting sicker and sicker, so that even women having this beautiful type of, conceiving, having a beautiful baby, are stroking out like left and right, and it's just sad. Tylenol finally came around and decided that they're going to decrease the recommended dose from 8,000 milligrams to 6,000 milligrams because, it kills more people than AIDS does. And so it's just kind of a joke about Tylenol. Once again, it's a medication for helping with so-called problems that just mask it. It's just like drinking whiskey. You drink it, the problem goes away until the whiskey wears off, you have a hangover. Same with these drugs. And we've talked about it, and we can talk about some more of these non-steroidal anti-inflammatories. Breastfeeding, weak. Yep. Boy, it's just really, really reassuring that the medical profession just really understands that breastfeeding should be done more. I mean, that's yes, everybody should make sure that they breathe oxygen all the time. Like, oh yeah, I mean, you need to become a doctor to know that. So in this particular Archives of Disease, Childhood, Fetal, and Neonatal Journal, July 2011, they have a big article that, you should breastfeed longer. I mean, this is just so ludicrous. Back in the 50s when I was growing up, unfortunately, my mom and a lot of moms had to be high-tech. They said, breastfeeding, that's been used for eons of time, but if you want to be a real current mom, you need to have this special super duper powder that's, we found out it's junk, it's garbage, doesn't help the kids, all kinds of long-term consequences. Breastfeeding is best. But that also goes back to the pregnancy, is the mother's milk is only as good as what the mother's health is, and that becomes a real big issue here. And so I try to tell my patients, if you're thinking about conceiving, you need to spend a little time trying to get your body in a little bit of order here. Now, I know sometimes that doesn't happen, passion takes over, or just things happen and you become pregnant, but that's the best, is that a healthy body will always do better. And the last one is that the Physicians for a Committee for Responsible Medicine has this big campaign. Hot dogs are just as bad as cigarettes. Yeah, well, hot dogs are just, once again, processed meats, lots of garbage. Full disclosure, I'm a vegetarian, so most of my friends and patients can eat good wholesome and there are good wholesome hot dogs, but we're talking about most of the hot dogs are just junk. And if you've ever been to a slaughterhouse, all the waste products are then put together, made into hot dogs, and they put lots of different types of drugs in there to make it good. So it was just kind of interesting. And then they had a quote from the representative from the Hot Dog Association saying, "Oh, this is crazy." Well, we know that processed meats, we've talked about that on my YouTubes here and elsewhere, I've read about it, is that contributes to colorectal cancer significantly. So just a couple little tips there for the week, and talk to you soon.